Hello, I am Dr. Kona Lakshmi, robotic minimal access GI surgeon from Yashoda Hospitals. Whenever we see a patient with complaints of hernia in the outpatient and we are explaining them the various treatments, there is always one concern which most of them say is, we have heard that whenever you treat a hernia surgically and it comes back, that means you have to keep on getting the surgery done. That is a very common answer what we get when we are explaining the various surgeries meant for treating the hernias. What causes recurrence for a hernia and how can we prevent that? So, you have to understand that hernia is a disease which happens because that area of the muscles, whether in the abdomen or in the groin or in the diaphragm, have become weak and the intestines are forcing their way through that weakness, and that weakness in that muscles can happen inherently, means you are born with weak muscles and over time with age the muscles become more weak in certain points, mainly like the umbilicus, groin and the hiatus, and then you develop a hernia, or some surgical process has happened like a small cut through the muscles, mainly with big surgical wounds like the traditional open surgery wounds where a large cut happens, lot of muscle is cut during this making these big cuts for doing the surgery, that weakens the muscle. Otherwise, people who have obesity or who are very thin, that their muscles are very thinned out, or they have chronic cough and chronic constipation, which over time weakens the muscles. So, for various reasons the muscle becomes weak, and once the weak area is so weak that your intra-abdominal pressure can force the intestines through that weak area, then it becomes a hernia. Now, treating a hernia, there is no medical treatment for any type of hernia. It is always a surgery, and surgery is a repair. Repair means you have to close the gap which has happened in the hernia for the various reasons we had already spoken of, and then you can't just depend on the thinned out muscle to again stay intact. So, we have to put a synthetic layer, what we call the mesh, over these thinned out muscles to give them strength and to prevent the hernia from coming back. Now, when we talk of a recurrence, means one surgery has been done to repair the hernia and it has come back. Now, what are the various reasons for that? It could be patient factors and it could be surgical factors, or it could be the material factor. So, when we come to patient's factor, means what are the things in the patient which are making the hernia come back again and again. So, the patient factors could be, as discussed, it could be obesity, or your muscles are very weak and then you are smoking. Smoking causes more damage to the muscle, or you have constipation, or you have chronic cough which is not treated. If you have any of these things, then definitely it is a risk factor for hernia recurrence. If you are going for a hernia recurrence, you have to control your weight and you have to give up smoking, and then if you have chronic cough and constipation, get them treated before coming for a hernia repair. And when we say surgical factors, yes, it all depends upon the way the muscles are again brought together and sutured in place and the mesh is placed. So, it is a fine surgical technique. It is not a very lightly taken surgery that, oh, hernia, you just put some sutures and put a mesh. No, it does not work like that. Hernia repair and abdominal wall reconstruction are well defined specialties where the surgeon should be well experienced in knowing all the different planes and the size of the mesh that has to be placed. So, if your surgery is done by a well qualified hernia surgeon and who knows exactly the way it has to be done, and a good size and good quality of the mesh is placed, definitely your hernia recurrence can be minimized to the least. So, when you are opting for a hernia surgery, keep an eye on all these things. If there are any inherent troubles in you, get them corrected, and always choose a proper surgeon and a hospital where they have good reputation for good results in hernia, and get your hernia surgery done there. Thank you.